Welcome back, everyone. We're diving into, well, another fascinating find from AIagentstore.ai today. It's become quite the source for us, hasn't it?
It really has. Always something new popping up.
Definitely. So today, we're looking at an AI agent called Diagnostics AI. Some might know it as PCR AI.
Right.
Imagine a lab, maybe processing hundreds, thousands of PCR tests every single day. Each one needs super careful interpretation, no errors under pressure. That sounds like a major bottleneck.
Oh, absolutely. A huge one.
And this AI, Diagnostics AI, its whole mission is apparently to automate that PCR interpretation, the quality control, even compliance, basically streamlining these really complex workflows.
Yeah, that's the core idea.
Okay, so let's unpack this PCR AI then. What's its daily routine? What specific jobs does it actually do? And who really benefits the most here?
Well, what makes it so effective is, I think, how comprehensive it is. Diagnostics AI is great at real-time analysis of those amplification curves.
The squiggly graphs.
Exactly, those squiggly graphs that tell you if a genetic target is there and, how much. Reading those manually takes time. It's meticulous work.
I bet.
So the AI automates that, and it also automatically enforces these really crucial quality control standards. Think ResGuard rules, Levy-Jennings.
The statistical checks for reliability.
Precisely. They're the gold standard, and the AI ensures they're applied just right. It's also very good at spotting errors. Comprehensive error detection,
Like what kind of errors?
anomalies in the test run itself, maybe potential contamination, even subtle little deviations in a curve that, frankly, a human eye might just miss. And all this gets reported directly into the LIMS, the Laboratory Information Management Systems. That's the central hub for lab data.
So it integrates directly.
Yes, and its operational autonomy is really high.
Yeah.
It does these critical tasks without someone needing to step in manually. Plus, it ensures adherence to strict regulations like CE-IVDR and MHRA.
So European and UK standards for medical devices,
Yeah.
that's serious compliance.
Very serious. It has to meet those high bars.
That automation for quality checks sounds, well, incredible. But what's the actual difference it makes? On the ground, in a busy clinical lab, what's the real-world payoff?
Yeah, this is where you see the big advantages. This AI agent pushes accuracy up over 99.9% in clinical settings.
Over 99.9%?
Yeah, and in PCR diagnostics, that's not just a number, right? It means fewer false negatives, faster decisions for patient treatment, and way less costly retesting.
Every fraction of a percent counts there.
It absolutely does. Huge real-world impact. It also really enhances traceability and speeds up the whole real-time PCR analysis process dramatically.
And who feels that benefit most?
The main beneficiaries: clinical lab scientists, molecular biologists, definitely lab directors, bioinformaticians, quality control officers too. It really shines in generating these audit-ready reports super efficiently. That's a huge win for compliance.
Makes sense. Less paperwork, faster audits.
Exactly. And, this level of precision we're seeing with Diagnostics AI, it isn't some isolated thing. It really points to a much broader trend.
Nice.
Well, we're seeing some fascinating studies showing how AI's analytical power is just transforming diagnostic accuracy generally. For instance, some AI-assisted tools have shown they can really boost a clinician's diagnostic accuracy, sometimes jumping from, say, 75% up to 85%.
That's a significant jump.
It is. And even more striking, in some specific reasoning tasks, AI models have actually outperformed human doctors. Things like spotting really subtle issues in medical images or finding obscure patterns, achieving like 80% correct diagnoses compared to maybe 30% for doctors in certain narrow studies.
Wow, 80 versus 30.
Yeah. Now, this isn't about replacing doctors or human experts at all. It's about augmenting their abilities in profound ways.
Okay, so bringing this back, what does all this mean for you, our listener, who's trying to get a handle on these developments quickly but, thoroughly?
Well, I think these advancements, they represent a really critical leap towards more efficient, more precise, and definitely more reliable medical diagnostics.
Right. They're changing how labs work, which directly impacts the speed and accuracy of health information, which ultimately means, hopefully, better and faster patient care.
That's the goal.
So here's a final thought for you today. Think about how this increasing precision and autonomy of AI in diagnostics might reshape the human roles in labs.
Interesting point.
Yeah, could it free up the experts, the scientists, to focus even more on the really tricky stuff? The nuanced analysis, complex problem solving, the cases that really need that unique human insight.
It certainly could shift the focus. More complex work, less routine checking.
Something to consider. If you want to explore Diagnostics AI or other innovative agents like it, you can visit aiagentstore.ai.
Good place to browse.
And as always, thank you so much for rating the show. We really do appreciate it.